That's a better one. It's got some chunky tissue in it. Have I missed it?
Yeah.
Yeah, just come out and touch Sajida. Yeah, it's right there. I can still salvage it. Okay, let me just take it out, do it again. These are the difficult ones, the ones that are deep in the pelvis, but you have to do them right. Come out a touch. Okay, let's try again. Come out of this side. Come out of this side. Yeah.
Okay.
Okay, we are through. Okay.
Yeah.
Can you hold that first? Can you hold that first? That was a nice decent bite. As you can see, I probably got the muscularis propria with that bite. That's what you want. Okay, so I'll put one more stitch before we staple it to the sacral promontory. Yeah, put it up there. I put the next one. I put right in the, or try to put it right in the body, in between the first and the second stitch. Oh, sorry. Get a stitch, please.
Okay. Let's continue with that for a little while. That's that volume.
Okay.
There are many ways of creating the melatonin, and all have the same obviously you should choose whichever way you are creating information. एक मुझे चाहिए था
This technique was developed in Belgium by a guy called Ho, H-O-O-R-E, and he has done a lot of these. And then there's a big center in Oxford in UK where there's a guy called Ian Lindsay in Professor Neil Motterson's unit who does that. And it's quite a useful technique because you don't have to dissect posteriorly. The biggest criticism of posterior dissection is the fact that you can damage nerves, especially in a man.
I don't use various needles, but you should do whatever you are trained in. And this is semi-open method. Semi-open method of
Okay, got your needle? Yeah, all the needle counts are correct, yeah? Right, just a couple of tips. Now we'll see how much tension we require for this thing to go on the sacral promontory.
What do you mean by semi-open?
semi-open means that you have mini elbow under the knee.
Okay, gently there. Just pull out Sajida.
Then you come here.
Just gently there. Okay, hold it there. So now the tension has to be right to pull this up, and tension matters a lot in internal susception. Probably won't matter this much for this guy, but you need to have the right tension so that you get good results. Tip top, please. And have you opened a ProTac? ProTac. So that's it. So basically, look up please. Yeah. This is what I recommend. Attention. So if you put it too tight, that's too tight. If you put it too lax, it's not going to work. So this is kind of what I normally do. Look down, please.
First of all, we check if we have caused any injury during
Let's go inside. You're looking down, aren't you? Yeah.
feature of that. The texture of the looks good.
So I'm just trying to feel for the sacral promontory. So I can put my tacker there. Once I've done that, I adjust the tension. Just look up Sajda. So this is probably right. This is what I'll do. Are you with me? They're all going to sleep.
I call it little lateral and I call
So you've got a ProTac now.
if it is wide sphincter patient,
And do the final adjustment with the ProTac. And tighten it right up. You can see the iliacs on that side. Obviously, you don't want to do that.
then patient does not matter whether you go
Look up Sajida so I can see the rectum.
or
Who's that your thing is not on anything, is it? Let go. Let go. No, come out Sajida. It's very gently, yeah? Okay, just to keep it out of my way. So are you happy with the tension, everybody in the audience? Happy nahi chalega.
Yeah, I think they are switched on to the other side.
Oh, I see. So that's the look up. Would you stop flashing? Don't flash. Look down. Okay, I think this is the kind of tension I need, but I want to make sure that I'm not there. That's my promontory. Okay. Don't flash. I just said don't flash. I'm doing an important part. Okay, Sajida, look up. Show me the tension. Slightly, maybe slightly. There, that's it. That's just right, yeah?
So you haven't tacked it to the dissected part. It's on the.
Yeah, I know. It's okay. I just, I rather, because I can't see anything, I can't see underneath it, isn't it?
Okay.
So it doesn't matter. You still have it covered. So you take this flash off. He's taking the flash off. Slightly lax, but I can correct it still. That's it. I normally put 4 tackles. You see the tension there? Just about right. Okay, scissors please. Are you with us, the audience?
शिफ्ट करा दो थोड़ी देर को यहाँ पे यहीं पे तो why can't they not
Can you hear us? Sajida, look at the
and
yeah, show me the mesh, the rest of the mesh, yeah. That's it. Yari, is this the rubbish scissors or is this the right scissors? These scissors. Excuse me? Scissors. ये वही scissors है जो पहले दी थी आपने मुझे? Let's see if we can cut the mesh now. Okay.
अच्छा चलो ठीक है I'll just
Tip top.
I'll just speak to ठीक है let me just
So this is the main part of the operation is done now. Now we need to cover this mesh with peritoneum. So that's the rest of the mesh. Just watch this guy's hand. Let go, let go. Let go. Right, go in there. So all we need to do now is cover this with peritoneum, yeah? Hold it up there. More stitches please. Stitches please. Stitches.
So this will go on one side of the
Yes, this is gone. You know the dissection that I did.
Yeah.
You will see after the first stitch, you will know what I mean. Sir, can you go and check the audience because I want to finish because I'm going to be finishing off. So as soon as I said finishing off, the needle dropped off. Just give me the other tip top. Okay, don't worry. It's okay. But this is relatively easier, this stitching as opposed to what we just did. So all I need to do is get a part of this there. It should probably be this. This should be just be good enough, and start stitching it right down.
okay are you going to do a continuous or
No, continuous becomes a bit of a
interrupted?
pain. So I'll just do it interrupted. And this stitching is a lot more easier than the one that we did over there because this is not deep in the rectum. Okay, go in please.
okay you're going to
Yeah, I
not
just do a
inside.
second one. Yeah, I just do a second one. Otherwise, it takes a long time to do. Right at my cut edge, yeah.
That was good.
And then if there are any gaps in the middle, we can always
Fill them
cover
up
them up with the
later.
interrupted suture afterwards. Cut the needle, please. Not pusher, thank you.
Tell me one thing, is this straight or is this straight? I'm talking about the position inside.
This is straight.
This is straight.
Almost, I mean, basically, there's no such thing as straight. This is all 363 dimensional. But what you want to see, as you like to see it in open surgery. So, in open surgery, if you're doing it open, that's how we're looking at it at the moment, won't we?
Yeah.
If you are standing on the other side, I'm standing on this side, that's how we'll be looking at it, won't we?
But it won't make much of a difference if it's like this.
Yeah,
or
true.
it's like
Not at this stage. not with this operation. If I was doing a left hemi or a anterior section, then it makes a difference.
Dr. Sohail?
3 knots is fine. Just sit.
Dr. Sohail, can you listen to us?
Oh, sorry.
Dr. Sohail?
Another stitch. Same thing over and over now. No, I'm fine. Yeah. Yes, ये लिखा लीजिए.
यहाँ पे start यहीं पे है ना कैमरा?
Are you guys with us now?
We can listen to you. Can you listen to us? Hello?
पता को चले तो
Dr. Sohail?
Ji,
Can you listen to us?
just right now, yeah. You just come back live on. Did you go away? Did you go for a cup of tea?
No, we were busy with the other case.
Right, fine. I'm only joking. Yeah. So what I did you see me staple it?
Yes, we
Okay, that's
saw
good.
you tucking in the proline mesh onto the sacral
Say, well, that's
promontory.
good. Well, we really haven't done too much after. Come out. We haven't really done too much after that. All we're going to do now is bury it. Bury the mesh because it's a proline mesh. It's not a composite mesh. So we just the cut off peritoneum that I created before. I'm just going to bury it in there.
Why don't you take a continuous proline?
Yeah, I don't like taking continuous. It just makes a little bit of a mess. Sometimes it snags. I find this a bit more in control. Yeah, but you know, there's no. If you want to try it or someone want to try it, there's no harm in it. This is just my thing, really.
Have you ever seen proline cutting through the rectum?
No, but proline can. When I consent these patients in women, I always consent them about pain during sexual intercourse because the mesh can sometimes erode into the vagina.
Right.
So they can get a degree of dyspareunia. Most of the time it's not such a big problem, but sometimes painful intercourse can be a bit of a problem. But it's not in the rectum, no. I have not seen it in the rectum. Cut, please. Okay. That's why some gynecologists don't like this operation. I mean, when the gynecologists repair rectocele from the bottom, they sometimes do a buttressing operation, sometimes they put a mesh from the bottom. So there is no difference if we put a mesh from the top, but we cure their prolapse as well. So basically, in essence, I've done the rectopexy bit. All I'm doing is covering the. I'm just going to do the same stitch all over, just reconstitute. So you can see that now the new inverted commas pouch of Douglas is very shallow, isn't it?
Right.
So what we have done, we have recreated the pouch of Douglas. Well, I keep calling it pouch of Douglas. It's not obviously the pouch of Douglas. So in a woman it would be a pouch of Douglas. But in a man, all we have done is we have recreated a shallow pouch of Douglas.
Some people even excise a bit of the peritoneum to make it shallow.
Yeah, I suppose you can do that, but not something that I've got experience with. Go ahead, please. So this is all I'm going to do next. If you have any questions, by all means fire away, unless you guys want to have a cup of tea or something. I think that's there's nothing exciting left here now.
So except those 4 stitches that you took on from the proline to the rectal wall, you did not take any other suture, did you? We missed that.
No, I didn't. If it was a woman, I would take another suture and stitch it onto the vagina.
Right.
But not in a man, obviously. But this mesh, because it's a proline mesh, it will provoke severe fibrosis in a short period of time. It will get anchored to the mesh.
What I was guessing is that the convex bit of the curvature of proline mesh, that would be a little away from the rectum if you don't tuck it in the middle.
Well, the problem is, yeah, I know what you're saying. If you do that, then you lose your tension on the mesh. This mesh has to be taut.
Right.
So I know what you're saying, because it does seem a bit taut, because if you don't make it taut, then it doesn't correct the internal intussusception bit of the prolapse.
Right.
Because there would be an internal intussusception as well. Obviously, in this person it becomes external intussusception, but there is an internal. So if you don't do that, then it doesn't straighten. So what we are trying to do is straighten the mesh, the rectum, the rectal tube.
Right.
It's a bit painful and after a little while this operation, watching stitches going all the time. I will need, yeah, a few more.
वहाँ पे स्टार्ट करा चुके हैं?
क्या दूसरा
So
केस?
can we have it shifted to the other side?
Can what?
Sure.
Sorry, what was the?
Can we have the camera shifted to the
Oh,
other side?
absolutely, yeah.
Yeah.
Ask the audience. I mean, that's all I'm going to do now.
Yeah.
We are done on this side. You can go on the other side. If you wish. It's hard if you do an operation with instruments that you're not used to.
You are taking the stitches quite wide from the margin. That is, you are doing it purposely or
You mean away, or do you mean distance between the stitches?
away from the margin?
No, not particularly. If I go too close to the margin, sometimes it's a bit flimsy, the tissue, but you know, something like that should be good enough. No, there's no particular reason for that. It's just, I just need to see a bit of robust tissue, otherwise they'll cheese wire. Just cut the needle, please. The length of this SC bond is very good.
Yeah, for this.
Scissors, please.
कल होगा जुनैद का कल है
Scissors, tip top. Thank you. आप सुबह